Hi, everyone. I'm Michelle Edmonds with Idaho News 6. And yes, this is our virtual town hall this evening, live on Facebook to talk to all of you about going safely back to school. Tonight, in particular, we are focusing on kindergarten through 12th grade, the K through 12 system. Where are we going to be a week from now? Where could we be 3 months from now? Where will we be a year from now? And joining me to help moderate tonight, my partner in crime during making the grades. This is Kevin Richard from Idaho Education News. Kevin, thank you so much for joining us.
Oh, thanks for having me, Michelle. I'm looking forward to the conversation. We've got some great experts ready to talk to us.
We have an incredible lineup for you, but of course, this discussion is a virtual town hall because we want to hear from you. We want your comments, your thoughts, your questions, your concerns, your hopes, hopefully, as we move forward into a new school year, literally starting in a matter of days. So as Kevin alluded to, we have an incredible group of experts. Let me bring them in and introduce them to you one by one. First of all, there's Dr. Amy Kahn. Dr. Kahn is the Executive Medical Director for Regents Blue Shield for both Utah and Idaho. She has been with me on our Rebound Idaho program before. Dr. Kahn, thanks for being here.
Great to be here, Michelle. Thank you.
Also on our medical team tonight, a local Caldwell pediatrician who works for St. Luke's. Dr. Marie Gessel is joining us, and it looks like she's even still at work this late hour. Thank you for being here. We appreciate all that you do in our community. We would be remiss if we weren't talking about schools and didn't invite Central District Health Liaison to school districts in Ada, Boise, Elmore, and Valley counties. Please let me welcome Gina Pinnell. Gina, as you've said, you've done some hard lifting over the last couple of months. We appreciate you being with us tonight.
Thank you.
Also on the board for Central District Health and an Ada County Commissioner, Diana Lachiondo. And you know what, honestly, Diana, I'm gonna have to pick on you a little bit too, because you're a mom, so you're dealing with this with all kinds of angles.
I sure am. I think we're all wearing a lot of hats in this moment and trying to grapple with it as best as we can.
We appreciate you joining us tonight. And of course, we would be remiss if we were talking K through 12 education and we didn't include the powerhouse of this conversation, and that would be our educators. So representing our elementary community, Nicole Sarti is joining us. She's a 5th grade teacher at Galileo STEM Academy in the West Ada District. She also, parents, has been piloting a program this summer online. So we plan to get a whole bunch of information from Nicole tonight.
Hello, thank you.
And coming to us all the way down in Kimberly, Idaho, Julie Underwood is joining us. Julie is a high school language arts teacher at Kimberly High. She's been teaching in that school district that's just outside of Twin Falls, in case you don't know where Kimberly is, since 2005. Julie, we can't wait to get your perspectives coming from a little bit of a smaller school district as well.
Thank you for having me.
So an incredible group of panels, and I'm seeing that people are already jumping on to join us tonight. Let me start with the heart of the matter, and this goes to our 2 doctors on the panel. When will we know if it's safe to get kids and educators back inside a classroom? Dr. Kahn?
Yes, thank you. And I look forward to Dr. Gessel's comments as well. Good evening, everyone. Thank you for joining. That is the $64,000 question, right? When will we know when it's safe? I would say that, we are living in an extraordinary time, one that we don't have a published playbook, one that we are all learning, and we continue to learn about the novel coronavirus that causes COVID-19, as well as how it's spread among school-age children. Meeting the educational and social needs of our kids, their educational needs, emotional support is critical for us all. And we know that that's top of mind for parents, educators, teachers, our employers, and our entire community. I think what the Back to School framework offers is a framework indeed that really looks at the vulnerabilities in the population, as well as the rate or the incident cases that are in the local community, in helping to guide us whether we go back to school in person, we embrace a blended method of educating our children, or we go back to a full distance learning model, keeping in mind that themes of flexibility, creativity, and being nimble are going to be essential for us to be successful, and that whatever we may decide today or tonight or this week, we may need to pivot depending on the impact of the pandemic and how well we're able to manage its spread.
Dr. Gessel, you're seeing that as you're working in Canyon County. In fact, I
Yes.
mean, as numbers continue to skyrocket, when is it safe and how do we know when it's safe?
So the number one problem is I disagree with Dr. Khan. This is not a $64,000 question. This is about a $64 million question. And it's one that we just don't have the answer to. It's incredibly frustrating, even as a physician, to constantly have patients come in and ask, what would you do? What would you do if your kids were going back to school? And I do have kids, by the way. And how would I know if it's safe? And at this moment, what we need to do is that very delicate balance between risk and need. And I certainly think there is a need for these kids to be in school. They can't live in isolation. My own teenagers are going a little crazy. We do have mental health issues that are occurring because these kids have been cut off from their normal social life and their normal social interaction. It's super important that we get them back to school. And I think the number one thing is to have a plan in place for that nimbleness that Dr. Khan was talking about. You know, we can't afford in both lives and illness and everything to be slow and lumbering. We have to be able to respond quickly and have a plan in place prior to those events occurring. And I think that's really the key. If I was, well, I am a parent, I would say, know what your school's plan is. And if they don't have a clear plan for when that first teacher shows up positive, when that first student shows up positive, if we don't have a clear plan to try as hard as we can to wash hands, wear a mask, and do those distances as best we can. Yes, these are 5-year-olds in some cases, and I understand that. This is really difficult. Your school needs a plan. If your school has a plan, you can feel much better about the fact they will have the ability to react in time to change course if needed.
I'd like to hear from the teachers. Do you feel safe? Julie headed back into the classroom. When are you supposed to head back in, and how are you feeling about your own personal safety?
Well, in Kimberly, we are heading back on the 20th for teachers and on the 26th for students. And at this time, I do not feel safe. And I feel like it is on the district they have the responsibility to provide a safe environment for educators as well as students. And right now with our plan, social distancing, and I am a secondary teacher, so social distancing is absolutely impossible in our building. We have 570 students approximately and 90 staff in a rural school that has 2 hallways. On the way to the office to get coffee or the way to the bathroom, it's backpack to backpack. Kids are just shoulder to shoulder. On the way back to my classroom, kids will bump me and spill my coffee on the way back. That's how crowded the hallways are. It is beyond social distancing. And our district has kind of recognized that and said, okay, let's make a plan. And the plan involves things that I just don't feel are practical. I mean, our plan is students, high school students, think back to high school, walking single file, going one way in a hallway and the other way in a hallway, and wearing masks is still being determined. We haven't made a call about masks, and right now they're not being mandated. Sanitizing before each class. For me, what we're asking students to enter into is in no way normal school. It is not school like we've done school. It is not the social, emotional, bonding, hanging with friends, spending time together school. It's going to make the pandemic front and center for every student every day, because they will be being asked to sanitize their hands before they enter the room, to wait while teachers sanitize the room between classes, to walk single file down the hallways, to not stand with their friends, to not eat close to their friends, to not socialize. So all the benefits of the social, emotional, and getting back to normal school during COVID is anything but normal. And I just feel like it is a responsibility of districts to provide us with a safe environment. And right now, I don't feel like we can do that. Idaho schools do not have the HVAC systems that hospitals and medical facilities have. Even when we've sought some updating information from the architectural firms, what they're asking us to do is far beyond the means of Idaho schools. So those things are not being implemented. We can't afford even the most minor of updates to the building. So we had budget cuts this year and didn't replace a couple of teachers. At least one middle school and one high school teacher have not been replaced that left this year due to the 1% budget cut that schools underwent. And we're expecting 5% next year. So asking us to prepare for this unique circumstance is beyond what we can manage right now.
Nicole, you've been working online this summer just trying to figure this all out with a small group in the classroom. Do you want to go back in the classroom or do you like what you're doing online?
Well, so of course, I want to go back to the classroom. That is my heart's desire, to be back in the classroom with my students, just like most of the teachers that I talk to. But as far as we've had a good time working this summer, I think that there's been some learning going on. The students, our doctors before said that they, really feel that the kids need to get together and just be social together. And I know that my students have enjoyed that. There's a lot of different apps that we've used, our Microsoft Teams of just getting together and being able to see each other and talk online. That's been really helpful. And then we've been very creative. We've been flexible, and it's a different type of learning, but it's learning, it's going forward, and we are making the best of it. Whether we're in school or online, we will continue learning.
And that's the teacher's mantra, no doubt. Kevin, you just are joining us from West Ada, where they are into a 4+ hour trustee session trying to figure out what's happening. Can you give us the latest on what you were listening to and your thoughts moving forward for this panel?
Well, as we speak, as you said, the West Ada School Board is still meeting. They're trying to figure out whether to open the school year as planned on August 27th or delay the opening, and what the opening might look like, and how the district might go with either a blended learning model or an online learning model, depending on what's happening with the case numbers. And I think it maybe leads to a question to shift gears a little bit and to hear from our folks from the Central District Health about that relationship between what the health district is seeing and what the health district is recommending in terms of guidelines, and there are guidelines and recommendations for the schools. How does that sync with what you're seeing the school districts talking about and planning on doing?
Diana, you want to take that one?
Sure, thanks. And I'll certainly refer over to Gina Pinnell, who's our staff member who's been working closely with all of the districts. So the back to school framework outlined the roles and responsibilities of each agency, and it's the role and responsibility of Central District Health to determine what phase of community spread or non-community spread each area is in. And I just came from my Central District Health Board meeting, and our staff, so Gina and all of the epidemiologic team and Russ, have determined that in Ada County, all 3 of our school districts, so Boise, West Ada, and Kuna School District, we're currently we're in the red zone. We are in substantial spread, while the school districts in Boise, Valley, and Elmore County are in the yellow zone. And for me, in my role as a board member, this is a top priority. We have got to be able to help our schools open safely for those kids, for families, for all the reasons that have been mentioned, but we have to do it right. And so, many of the steps that we've taken as a board, while they have been obviously very hard, having to close down businesses for a number of weeks now, mandating masks, they have been with an eye toward not only ensuring that we don't overwhelm the hospital systems, which has been a top goal all along, but also noting that these dates were looming. And I can speak to this more later in the show, but I think we really have to reflect on the activities that we've all been undertaking over the summer and what we'll be doing in the next few weeks. And I'm asking if those are leading toward a safe opening of school or not.
To maybe sharpen the question a little bit, Commissioner, Central District Health's recommendations at this point are that Ada County schools at this level of community spread should not open. They should go online only. And as we speak, West Ada's meeting to discuss what to do and discussing, is there a way to do blended learning, to have classes 2 days a week, even in this kind of level of spread? Does that concern you? This is the biggest district in the state.
So I'm concerned no matter which way we go, obviously. And I guess I would kind of refer over to Gina, because it was not a policy level decision by our board to determine whether we were in green, yellow, or red, but rather a staff decision to look at all the criteria and determine what phase of spread we're in. So I'd ask Gina to kind of help you understand what went into that.
Sure, thank you. So I'm going to backtrack a little bit. So the relationship that Central District Health had with the school districts in Region 4 started in March. And there has been a lot of planning and a lot of being nimble and a lot of new ideas that have been shared. And I just want to emphasize that some of the things that we hear our healthcare community and other community members and teachers asking for are taking place. And, you know, when they developed these plans, some of them did it early in June. It was just a different environment than it is now, obviously, with, you know, a couple hundred cases versus 8,000 cases in our district. And so when we designed the metrics to identify the levels of community spread, we did that with schools in mind and to give them that guidance and the recommendation for starting for the fall semester. And those plans that were developed by those individual school districts use our category recommendations to identify their operational components of how they want to move forward. And when we first started the conversation about the categories, you know, we were all under the impression that we would need to be in a stay-home order for Category 3 to be real. And now here we are in August, and that is not the case, because our case numbers are so high and so drastic that we don't feel comfortable letting schools open. So I think that they're struggling with the multiple needs, the behavioral health needs, the idea that, you know, online learning can be done very well for some students, but for especially younger students, you know, it's suboptimal, and there's just a lot of that social interaction, although it might look different, that is being missed out. And so we're looking to school boards to help educate them, to bring them on board, to have them understand about, you know, what it means when an exposure happens and what risk that plays. And so they're in a very difficult place to be able to make these decisions. And I think also with some of the school boards that have been meeting the last couple of days, you know, their start date isn't now. And these category recommendations are for a week at a time. So we gave those recommendations on Monday, and we will be giving them every Monday for this year for sure, and maybe even next year. And so I think that they're trying to pivot, and they're trying to shift, and they're trying to be nimble in their responses, recognizing that, you know, they did anticipate, I think, this Category 3, but they also know that they have potentially the ability to delay a start and hope that the transmission does get reduced. And as Diana mentioned, our board is looking at those ways that we can do that. And, you know, as a community, we really have to make those decisions on what our priorities are, because if we continue with our social gatherings and, you know, not wearing masks and not doing the things that we need to do, it's really going to be challenging to get schools back in session in person. And there has to be some trade-offs. And we don't think schools should be the lever that we pull to bring transmission rates down. It should be other things in the community that we can do as individuals and as groups of friends. We can make those choices to allow schools to open in person, because it's the best way for them to learn.
And quickly,
I would like to bring in, sorry, Kevin, go ahead.
Just quickly, a question about CDH and the policies, because I know there's a lot of interest in this. How CDH's policies regarding schools, how that relates to what happens in the schools. I mean, the mask mandate does apply to schools in Ada County, K-12 and higher education. You're talking about restricting group sizes. That may come up in a future CDH meeting. How would that apply to schools?
So I can take that one unless Diana wants to. So masks, we explicitly called out schools in our mask mandate because there was a lot of questions and concerns. And honestly, that wasn't a weight that we felt was where school districts should take on the burden. And we know that it's effective. We know that it's low cost, and we know that it makes them safer. So it was an easy decision for us. I think the group size gathering is when we get a lot, is how can groups under 50 or over 50 not be allowed, but you can have schools open. And one of the things that we look at is what type of environment are people in when those gatherings are taking place. And so school is not a social gathering. It is a controlled environment. You know where people come in and out of the building. You have, bathrooms. You have teachers who can be trained. You have staff that can be trained. You have protocols in place. You have the ability to enforce. And classrooms themselves are not over 50 people. And so we look at all of those and take them into consideration when you kind of turn and pivot and look at a social gathering like a barbecue or a bridal shower or something along those lines. No one's enforcing that we're aware of those types of activities, and that's not the same as a structured environment with mentors and people who are teaching our kids really everything from kindergarten up to 12th grade. And so that exception, they don't apply to the social gathering rule or public health order that from Central District Health.
Gina, that's great information. I want to just bring our viewers and listeners up to speed. If you're joining us live on Facebook, I'm Michelle Edmonds with Idaho News 6. We are doing a Safely Back to School virtual town hall. We are live at the moment taking questions and comments from the public with a group of experts who, quite frankly, everybody you see on the screen has a heart for kids. So we are all in this together, and we're trying to make the best decisions with the best information we have. Interesting question. And Dr. Gessel, I'd like to have you look at this first. This is from Cody. I'll be able to put it up on the screen here and read it to you. What difference will it make if kids go 2 days a week or 5 days a week? I don't get it. They could still be exposed. So we're talking about the blended learning model here. Please explain the difference that blended learning would make. From a pediatrician's perspective in Caldwell, does it make a difference if we limit the amount of time in school?
I think you need to look at this in terms of just total access to potential exposure. One of the things is a lot of schools are going to 2 days for half of the students and 2 days for the additional half. That helps address some of just the crowd numbers, if you will. As far as going 2 days for everyone in the school, just those 2 days, you still have a relative improvement in the risk that you're taking because you are limiting the total number of hours that those people are together. I think it has to be a decision made by each school, even maybe by grade or class size or the ages that we're dealing with, as to whether that truly is limiting our exposure and is beneficial, or if there are other ways. And I think that's the biggest thing, is that there are multiple ways for us to creatively get to the point we want to be at, which is to reduce that exposure. And so putting into practice those ways that actually work for your school, for your district, I think is really important. But yes, having 2 days instead of 5 technically would decrease the total number of hours that you are potentially exposed.
Dr. Khan, this is an interesting comment as well, is talking about the same sort of thing, maybe only doing essential classes or having the same group of students attend. One group comes 8 to 12, another group comes 12 to 3. Dr. Khan, my question is, what have we learned about the virus now over this summer period that makes things different than when everything exploded back in March? Because I'm still thinking, if I'm sending my kids to school, they're going to have to Lysol every single thing they touch. Is that all still true?
Right. Those are great questions, Michelle. And I think we need to kind of go back. It's been, it'll be 5 months that the kids were sent home, and that was done very abruptly, right? When we saw the virus spreading throughout the community, it was very swift in how everyone was sent home. And quite frankly, I think it was pretty traumatic for everyone, including our children, because they didn't get to say goodbye to their teachers or their friends or what have you. And now we're talking about several months since the pandemic has now taken a foothold, much more active in some of our communities than others across the state. And what we do know is this is a principally transmitted through droplet transmission. This is why the 3Ds are so important. That's density, distance, and duration. We don't want to have large gatherings. It's part of the kind of the science behind splitting up classrooms so that the kids can be more physically distant. They're not as dense, maybe not as many kids in the school going through those hallways at one time. In the duration of exposure, as mentioned by Dr. Gessel, is lower. And then, of course, we want to make sure that there is widespread adoption, not only at the school, but throughout the community, in our workplaces, for wearing face masks so that we protect other individuals from us, where we catch our respiratory secretions, if you will, that we maintain regular hand washing. So important, really going to be important in the school setting where there might be shared surfaces, desks, a laptop, a keyboard, what have you, doorknobs. That's important, of course. And then being mindful of that space between each other. So whether the school decides to use the in-person time for those essential classes and use other times for those classes that could be more easily adapted to a distance learning, whether they split the classes or have class starting early and maybe going in the morning and afternoon. These are strategies that I think are all meritorious as we consider individual risks, because there are going to be patients or members or teachers or children that we simply can't bring in person. And there are going to be situations where, depending on the burst or the density of the scenario, right? We don't want to gather lots of people in a gymnasium, for example, or at a spectator event necessarily when they're right next to each other. We need to think about adapting that environment. So these are all considerations that are appropriate. And of course, looking at the rate of spread in the community, the incident cases per 100,000 certainly are going to be important. If we all collectively did adopt those safe precautions, those respiratory precautions and other mitigation practices, we will lower the rate in the community. It will be lesser risk for those kids or teachers when they do go in person.
Dr. Gessel, we're getting an interesting question here, and this kind of goes along my same lines to Dr. Khan about what we've learned about the virus. There's so much information out there, and Jennifer Sheldon is asking this. What do we know about the virus when it comes to children? How is it affecting children? What age are children getting sick? What age are they transmitting? I think part of the frustration from my own personal sake as a mom, from being a community member, is that obviously the information does keep changing because we get more information about what this virus does. Can you explain a little bit about what you've read and seen when it comes to children and the virus?
A fairly widespread belief that children actually didn't get the virus. Obviously, as with any coronavirus, any of these viruses that run through the community, they are getting it. But for reasons that none of us really understand, the majority of the children's cases are very mild. Now, because they're so mild, then we thought, well, maybe they're not passing it. Part of that has to do with like things like how well they can cough things out, or stuff like that, which makes a difference. But we're not really sure why. Now, the most recent peer-reviewed article that I've read on children and their ability to pass, they did do a fairly robust study. It's a retroactive study, so they've looked at cases in multiple countries of children between the ages of 10 and 18, and found that the rate of transmission in this retroactive study, which of course is not a perfect way to study, the rate of transmission is actually equal to adults in that age group. So that was the most recent. I read that last week. Younger kids, we still have a big question mark as to how do they pass it? Do they pass it when they have no symptoms? Do they pass it as easily as adults do? Is it just a nature of the fact that they aren't interacting as much with other people? So that's what we know right now. Now, next week, it could be different. And the more studies that come out, the more sure we're going to be, because this is also brand new. But right now, we are assuming, at least the majority of the medical community is assuming, that those older kids can pass it as easily as the adults can.
Gina, has there been any discussion from Central District Health as you start to develop these plans with the school districts, that the plans, I know it's this kind of stoplight approach, the red, the yellow, the green. Could those plans, could you see them radically changing as we get new information in? Could we start school one way and 3 months from now be a totally different way just because we have new information?
That's a great question. I don't know if in the time frame of 3 months that's realistic, but I do think that plans will be changing and they will be nimble. There will be schools, the smaller charter schools, that perhaps open in a limited capacity. You know, we've had schools call and ask us, hey, we have these high-risk students, we have single parents that we know that our services are essential and we want to accommodate that. And typically we have 400 kids, we want to bring in 30. Can we do that? And, you know, those types of situations I feel like are safe, and they're a great opportunity because of the things that we mentioned. The density is smaller. They're looking at shorter days. They're looking at how they can accommodate that. And we don't want to call a school a pilot, but some people are going to have to kind of step out and run through their plans and see what's working. And we can pull that same information from other countries on what's worked. What are the cautionary tales that we can learn from? And I think that, you know, I think plans can change. And one of the things that I have a weekly call with the school administrators, and we're talking about, where is the orange? We have this green, we have a yellow, we have a red, but there is an orange in there. And where is it? And how do we fit? And how can we make that accommodating? Because we know students and families who want to be there will be there. We believe, and I have a lot of trust in teachers. They've gotten my kids to do things I never could, to be able to help kids learn and understand, you know, what is happening. And I don't, you know, in general, I don't know that our young kids are doing that. And honestly, they want to do the right thing. And are they getting the right information? And can we train our teachers to help with that? And can we provide them the tools and the knowledge they need to make the right decisions? And you know, I've seen a lot of confidence in teachers and administrators in thinking that they can tackle this really profound challenge that no one ever expected. So that's a little bit of a long answer to your question, but I do think that they will adapt and evolve as we learn more. And I don't know, back to the teacher from Kimberly, you know, there's a lot of fear out there, and this new normal is certainly different. And I think that there's an expectation now that we're here at least for this year and possibly next, and we don't really know the time frame. So this isn't a Band-Aid. This isn't something that we're just trying to do to minimize the impact in a short term. We have to figure this out because we're going to be here for a while, and we need to figure out how we get our kids in the school safely.
Julie, how do you manage that as a teacher when you hear somebody from a district health department saying, this may not just be 2020, 2021, this could be further than that? Because as a parent, yes, it absolutely freaks me out, even though as a journalist, I know for a fact that it could be true. Tell me from a teacher's perspective what you're dealing with mentally.
Well, first of all, you know, it's very difficult because I would love to be in the classroom. That's why I'm a teacher. And it's so much easier with my students. I mean, last spring I was teaching speech, and a speech that a kid records and uploads is a completely different creature than a speech that they do in class as public speaking, where there's public to watch them. So I understand the challenges. I am hopeful, and it feels like a few of our national experts are hopeful that we're within a year of a vaccine of some kind, but I understand it takes a while after a vaccine happens. So it's very scary for me to hear that this is a longer term solution, because the recommendations that are coming from the medical people, first and foremost, is social distancing. Second is masks, then hand sanitation and these, you know, cleaning processes. And I don't see that all school districts are even embracing those. We are not completely there yet. Social distancing now says as possible, which it's impossible in my building. And I mean, I love kids and I want to be in person, but I don't want to take the risk that a firefighter takes and every day be deciding, Do I run into the burning building? That's not why I chose to be a teacher. I'm not a medical professional, an emergency response person on purpose, because I didn't want to deal with that risk every day. I'm in an older category. I'm, in a high risk group. And so I just feel like and I'm not being given much of a choice. And the conversation in our house has gone so far as to say, my husband is concerned about my safety. And he said, this is your career and it's all your decision. But if you don't feel comfortable going back, we'll find a way financially to make it work. And that's serious when teachers I'm going into my 19th year of teaching. This is my career. I have a master's degree in education. I'm invested. I love kids. I love education. I love teaching. And I'm having to look at saying, can I do this year? And if it's going to be more than this year, for me, there's a safe alternative, and that's remote education. I know it's not ideal, but risking teachers and students' lives is not ideal. If it was traumatic last March, not getting to say goodbye to your teacher, what about if your teacher dies? And statistically, if we don't think that we're all going to be a statistical anomaly, there will be deaths of students and teachers. So to me, you do have to weigh the risk. And we don't even know what we're dealing with. This virus has a long tail and long, term effects that we can't even measure yet. So all those things scare me. And I would love to go back to normal. I would love to be back in school, but I am very fearful about that.
Nicole, I have to bring you into the conversation as well. Again, if people are just joining us, Nicole Sardi teaches 5th grade at Galileo in West Ada. She's been piloting a program this summer with students online. Nicole, tell us about how it's gone and what have you learned as a teacher about online learning? And even, I'll put you in the hot spot, if you had a choice, would you go back in the classroom or would you continue to be online?
So I definitely would go back in the classroom. I enjoy working with the kids one-on-one, in person, in small groups where they can meet with each other and talk with each other. So yes, I would be in the classroom, but the online learning it's been an exciting educational opportunity. And that's how we look at it every day. This is our educational journey that we've been on this summer, and what we're doing to help ourselves with next year, help the other teachers that we'll be working with next year, the other students. And I tell my students every day that, this is an opportunity for them to help teachers and to help the other kids, and they're just going to be that one step ahead. So some of the fun things that we've done is they've met in small groups. So we've still had small group learning. We use different apps, Flipgrid, Seesaw, and Wakelet to relay information, to share the information, to find out what my kids are doing. And it's been good. It's definitely different. You're teaching differently than what you would in the classroom, but we're still learning. We're still going. So, and I've seen a lot of pets. We've seen a lot of pets and fuzzy
Nicole
blankets.
And Julie, you didn't plan to do this in the spring, and you probably didn't plan on doing this again in the fall.
No.
How will online learning look different for your kids, and how will it look different for the parents who are going to have to support their kids this fall? What are you doing differently based on what you learned in the spring?
Well, in the spring, West Ada had packets for our K through 5 teachers and students, and so they focused on the technology for the 6th through 12th. So the difference when the fall will be that everyone will be online, and we all have technology. We're one-to-one devices for everybody. So that's a big difference right there. And then what we're starting to look at then is how do you connect? Because teachers really want a positive classroom climate with their students, that there's that trust factor, there's just where you like to come to school every day and you want to be there. So how do you get kids to log in every day when it might not, if parents are working, how do you know that they're logging in? So you really want to build that climate, that positive climate culture, even if it's online. And so that's a big difference. And you're still moving forward. So instead of textbooks, you do a lot that's online. Wakelet's a great program that we've used this summer to just have all the resources that I want to share with my students, and that's there at their fingertips whenever they need it.
And Julie, you're an English teacher, so how does English translate into an online setting as opposed to maybe a class that has to be a little bit more hands-on?
Well, I agree with Nicole. There's a number of some of the same things that we did. In the spring, we were in crisis management mode. And, you know, some of us had more technology skills than others. But with students, we were concerned about their social and emotional well-being. And we were told as a district, you know, and I feel like Kimberly School District, we were making plans actually before the shutdown. We had 2 days of, or a day scheduled for teachers to just make a plan in case. And then the state shut down that day. And so we had one additional day where students could come in and get prepared. We had one-to-one devices, so students were set up to go. But we have learned as teachers so much about remote and distance learning, which is so different than crisis management. It's not at all the same. Our expectations for students will be more like realistic school. We were worried about the stress and concern that the whole country, world was under at that time. And so our expectations were moderated. But now we have a plan. We've learned about technologies that allow for small groups, just like Nicole was talking about. I didn't even know that was a possibility last spring. And now there's small groups, and we all have been trained on how to do that. Course design, how to lead students through the instruction and objectives that they need to meet, and to make it student-centered and focused on mastery. I'm redesigning my courses completely. And in English, it's going to be based on mastery, where students can work at their own pace. Like Nicole, I see it as an academic, you know, challenge, and it's been a motivating thing. And for students, those especially who enjoy technology, and I understand that's not everyone, but a lot of students who this is their world, teenagers right now, they love the virtual world. For them, it allows the kids, it's automatically differentiated instruction. The kids who can move rapidly through a unit. We had some kids finish earlier than other students, even last spring, because they met all the standards. And it will be even more that way this year. And we found ways to make it more engaging. I've learned about videos and apps that allow you to embed questions as a student listens to an instructional video to keep them engaged and involved. We've learned about the value of synchronous instruction, where we do live meetings and the variations of how to do that, and to have students meet that way. So I feel like we can really do some live remote community building that's really going to work with students to help them feel drawn in, to require their conversations and their interaction in a remote classroom. So I think it will be a completely different feature, and it's been exciting learning how to do it. I've learned a lot of new apps and new technologies.
Julie, continue to talk to me, and Nicole, you can jump in on this too. What about kids who are on an IEP, or who have a special need of some sort? Or we've got gifted and talented students on a spectrum. How do school districts, how do teachers, how do you need your school districts to help those children who have extra special needs, whatever they may be? And doctors, is this the type of environment where maybe school districts allow those students to go back into some type of classroom? Is that how we handle this? I don't know who wants to take that first. Nicole, do you have any thoughts?
Well, I know that we've been working with different students, and there's a lot that you can do, especially with the technology. It was mentioned earlier, Julie said that, you know, students are able to work at their own pace. And I know I've met one-on-one with my students in small groups, and they've worked together. I've worked with them, and it's just a different beast, I guess, because you're just working differently, and we have to really rethink how we work with these kids. So there are programs that we can do. There's apps that work with that. You know, I don't know if they would go into the school. That would be a decision that the districts would have to make. But there are activities, there are ways that you can do it. And I know that our districts are working diligently to make sure that all kids' needs are being met.
And the same is true in Kimberly. When we've discussed our yellow situation, we have talked about just that, where students would come in small groups, and it would be targeted for IEP students, some of our 504 students, you know, students who have special needs and need that one-on-one. Some of the younger students, that we could access the buildings and use them for small groups where social distancing is possible and wearing masks can be managed. And students come in for part of the day. And that's what we've looked at, is having small groups come in for a portion of the day to do certain things. Like even under yellow, I also teach dual credit communication 101. And we talked about having them come in to assess in small groups so that we can do their tests more like real world assessments instead of what we did last spring. So I know our district is working diligently on how, and even having teachers meet with them in separate locations and dispatching the teacher, but we can do a lot of that virtually if we can just get enough support to get kids in a virtual. One of my methods I'm going to use, a new method, is a virtual one-on-one meeting where I have a student, talk with me individually. We check in once a week about their learning. That's one of the new things that I learned in a training just 2 weeks ago. So I think it's going to be really valuable for helping students manage.
I need to jump in here with a little bit of breaking news, as we like to call it in the news business, but it sounds like the West Ada School District, where we have 40,000 students, trustees have voted to delay the first day of school until September 8th. And on top of that, they will decide, it sounds like at this point, in a board meeting on August 24th, what that first day will look like, whether or not they are in the red or yellow or most likely not green category, but if that will be a blended learning model, if it will be a remote online learning model. Diana, can I bring you back into this conversation? Because you were talking before about how it's going to take everybody in the community in order to get back students into the classroom. And at this point, I'd like to get your feelings about what it means to delay school, if you think that's a good idea with what you've seen, and what we all need to do, because I know you have a pretty strong message.
Well, again, it is the school district's role and responsibility to determine, how they want to move forward. But I do think it is a smart choice, given that we are still seeing a really high positivity rate and just our day-over-day cases. We are in Ada County starting, hopefully, to see a leveling off of cases. And we're hoping that that is going to continue to be a trend, but it's certainly not a given. And I think as community members, we need to ask ourselves, what are we doing to address this? What can I personally do to make sure that our kids can get safely back to school? And for me, it means if I have a family gathering, it is outside. And if we are going to be in close proximity, we are definitely wearing face coverings. And I think that's one of the things we need to speak to. We're seeing less and less cases come out from maybe a grocery store or a restaurant, and more from those family gatherings. It's hard. We're social creatures. We want to be around our families, but we've got to be mindful toward what we need to accomplish in terms of getting our kids back to school. And so that's really my message to the community, that this needs to be something that we can all pull together on, so we can drive down those cases and get our kids back to some kind of semblance of learning.
And Commissioner, you alluded to it, and Gina, maybe you can jump in on this as well. What are you looking at in terms of the numbers? What are the metrics that really are going to drive the policy and the recommendations that come from the health district? Because it's not just the raw case numbers, there's more to it than that.
Well, I will let Gina take that one, but I'll tell you at a very high level, it's a combination of different factors. It is certainly case counts, but also, what is the status of our healthcare workers? How many cases do we have coming out of various kinds of community settings? Can we trace all the cases, or do we not know how people are getting COVID? Those are all different metrics that Gina and the team at Central District Health are looking at, and I'll let her use her wonderful professional expertise to share that with you.
Well, thank you, Diana. She actually hit the nail on the head. Those are the metrics. When we have the categories and how we define those, they are based on category 1, 2, and 3, and each one of those have their own metrics. And, I don't need to repeat them necessarily, but word for word, I can. It's large-scale community transmission is number 1, which we definitely have. Healthcare staffing significantly impacted, which we do. And I can share that our metrics really look at some things within the healthcare setting that they have identified aren't the perfect metrics for them for the healthcare staffing impact. But so we're going to end up modifying those a little bit, because these are really where they would see themselves in a stay-at-home order potentially, but they are being impacted, whether it's a certain percentage of COVID admissions or a certain percentage of their hospital admissions, having a potential for COVID or COVID-like symptoms. It's a number of healthcare staff being personnel that are impacted or not able to work because either they were exposed or they tested positive, as well as multiple cases within communities, communal settings. So thinking about our jail, thinking about community areas like assisted living, nursing homes, those types of things. We are seeing those, and I will echo what Diana said. We have one objective right now in Ada County, and it's to lower the transmission rate that we see, and to lower the cases, and to lower the impact on healthcare and on public health. You know, we have contact tracers, we have built a team up, and we're continuing to build them, but it's very heavy still for us. And we know and do expect when schools open that we'll see some cases, and we think that the protocols and hope and believe that schools have given a lot of thought to those protocols on if there is a positive case, how do they handle that so that the impact is less? How are they, setting up their classrooms so there are limited close contacts, if none at all, if that's possible, and making it so that those cases, as they're introduced into the community, can be managed and managed safely without tipping us, as Diana said, with their fingers crossed. We're kind of there, but it's not a trend. But we can't be kind of there when schools open. We need to be there, and we need to be able to allow for that flexibility so that schools can open. And honestly, I think it's coming down to right now, a lot of districts may end up determining online is where they'll be. And even with the delayed start date, which I also think is wise, we hope and we want to see the reduction in those case numbers, but we might not get there. And not getting there doesn't allow parent choice of what they want. And that yellow at least allows some choice for parents to say, we've assessed the risks within our family and our extended family. There's probably teachers out there. I know there's teachers out there who want to be in person and who are willing to take the risk, and others who want to go online. And what is that divide? Are the ones that want to go online, can they be paired up with the online teachers? There might be some more natural occurring divisions there that we can leverage. But until we meet that objective, that single objective, which is asking ourselves as individuals, what can we do to impact that choice is mostly taken away from parents to be able to make that decision.
Dr. Khan, I feel like we have to talk mental health a little bit here because Adriana, I think, puts a nail on the head. All this uncertainty makes me feel emotional, right? And as parents, as educators, as healthcare providers, as this country has gone through this pandemic, the world has, we've all had a lot of emotions. And so talk to me about mental health when it comes to the education field and what we need to be doing from the outside world to be able to support our teachers, our educators, our administrators, our trustees, and our students. Because yes, everybody wants to get kids back in the classroom, but there's mental health factors that we can be doing to help them right now.
Absolutely, Michelle. I think it's really important as parents that we're talking to our kids in an age-appropriate manner about what's going on, right? I think it's super important that we maintain those lines of communication, not only with our families, but also with our educators and teachers in the community. Otherwise, we're sort of alone with our own thoughts, which often can be kind of terrifying. I also want to sort of say that, you cannot, listen to the news or pick up a paper or read online without, kind of being overwhelmed. And I think what I'm really reflecting on tonight and hearing many of the comments of my co-participants tonight is that we are dealing with a certain level of uncertainty, and as such, we're all in this together. So I think there is something to be said for continuing to support each other, to take a personal assessment on our individual risks. I really want to emphasize that whether your school is going in person or 100% online, or it's a blend, each family, each student, each parent needs to assess, what is my personal risk? As a teacher, it is very important that we think about voluntary in-person learning, because for some people, it's either their risk or them bringing it home, and that's too much for them. We also definitely need to accommodate our teachers and think about creative ways to address any of those anxieties that may be coming up around effectively producing or preparing our students in terms of their educational lessons. And I want to emphasize something one of our co-presenters mentioned about, in a virtual setting, we can also connect with our youngsters through home groups, if you will, or smaller groups where there's individual connectivity, if you will, although a virtual medium can be very successful in helping to really push back against the sense of isolation or loneliness or fear. And then, of course, lastly, I do want to share that it's really important that we, embrace what we know about this virus and how it's transmitted, and then really support each other in taking those steps to adopt and adapt those precautions that we've been advised to take. So it's mask wearing, physical distancing, hand washing, cleaning of the surfaces, but also connecting socially in ways that are meaningful and keep each other safe.
Dr. Gessel, I can only imagine working in Caldwell and being a mom and being a pediatrician that you have had to probably have phone calls, not just to the office, but to your home and your cell phone saying, what are you doing about school? What are you doing about school? Has it been that way? And what advice do you give to the freaking out parents?
I will give the same advice I give multiple times a day when parents come in and ask me that. What should I do? I take care of a large number of special needs children in our clinic, but whether it's a special needs child, a child with behavioral issues on an IEP, or just, a regular kiddo who's contemplating going back to school, my advice is follow your mommy heart. And that's what I tell them. If you feel the risk is too high because there's so much uncertainty, there is nothing that says that you have to take that risk. And I think that I applaud our districts and our schools and even some of my own staff here at St. Luke's, where we are working on how do we get this education to these kids when the risk really is just too high. For them. And I applaud all of the creativity and all the people who are working so hard on this. And I don't think school will ever be quite the same. And I don't think that's necessarily a bad thing. But if you just feel the risk is too high, then it's okay. It's okay to choose to not bring your kids to school. It's okay to choose to homeschool. It's okay to be a voice in your community when those decisions are being made.
Diana, you wear so many hats. Ada County Commissioner, member of the Central District Health Board. But I got to go back to what Dr. Gessel just said. What does your mommy heart say?
I've got
Today.
little boys behind me. And, I'm waiting to hear what my kids' school is going to be doing, just like everyone else. And I got to tell you, we really struggled this past spring. It was really hard. My husband is a physician and he's in the clinic all day. So I was county commissioning plus conducting 5th grade and 2nd grade myself. And it was really not a fantastic learning environment that I was creating. So I would get off a call and ask my 2nd grader, did you work on this thing? And he would tell me, no, I decided it was recess. So, and it was hard because on the one hand, when you're thinking, well, maybe this is just a few months, but now as we look forward to a whole year, I may even be thinking differently about it for even my 2 kids, because my older child is going into 6th grade, and I think I might be able to do something different for him, whereas my youngest is in 3rd, and I just am struggling with how he's going to learn effectively, just given his personality and his age. So for me, it's why I've emphasized with my family and with really all the community members about doing what we can to practice social distancing, to drive down the infection rate so we can help out our healthcare system, but also so we can safely get back to school. So, hoping that we can do that in the next couple of weeks. And if we can, I would like my kids to be able to go back in some form to in-person setting, but I'm waiting to see whether we'll be able to do that or not.
It's been a long summer of waiting. Kevin, do you have any last questions before we wrap up?
Well, I thought I wanted to ask the teachers one more question, and it kind of dovetails to a lot of the advice that we've heard from the other speakers. What can parents do? What's the one actionable thing that parents can do to support their kids and help you as educators? I mean, this is so overwhelming, but what's a digestible bite here that parents can take on that will make a difference?
Stay positive. And we've all said this, we are in this together, but we stay positive and we will learn in a different environment, in a different way, but we will learn, and it's a good thing. It's a good thing. We're still learning.
Agreed. Staying positive. One of the things I want to do is create a parent portal on my, electronic learning system. But I think I just see parents as our partners, and one of the best things they can do for their kids is set up a place and a routine for doing school, so that kids know. Especially a lot of teenagers like to work on their bed, and I sent my kids a whole methodology about how to set themselves up for success. Find a place where you do homework that's separate from where you sleep, where you eat, and even if it's a small chair, that you go to that chair. But giving them a routine and time frames and trying to keep some level of normalcy in their routine up is the best that parents can do, and just checking in on them.
Well, as Kevin well knows, excellent advice, teachers, as always. The way I tend to handle anything we're doing right now to help Idaho rebound as fast as possible is, it may be in my own personality, and Kevin knows quite well, I often ask him what socks he's wearing, and I won't do that to all of you, so don't worry. Kevin could show you, it's purple socks today, I already know. But I have to end these on a note of positivity. And since the teachers asked for it, let me just call on each one of you. And could you just, as we're ending tonight, give everybody out there in Facebook land, just from your expertise, from where you sit right now, what's the one bit of positive when we're faced against a deadly pandemic? So Dr. Khan, can I put you on the spot to go first? What's the one thing you want to let people know?
I really want to emphasize that what we need is to absolutely support each other and embrace each other with patience and understanding. And through that, this process, I really believe through collective wisdom, we are going to be successful as long as we're working together.
Dr. Gessel?
So just right along those same lines as Dr. Khan, and also to remember, we are blessed with people from all different areas of the world and in the United States that are working hard for us, for our children, to try and get on top of what's going on. And in the meantime, let's band together. Let's make a concerted effort to protect each other as best we can.
Gina, from your seat at Central District Health, it's been a whiplash, I know. So what's the positive message going forward?
The public health person in me wants me to say, practice the preventative health measures, but that's not very exciting. And so my answer is to assume good intent. And I'm not seeing that a lot. I'm seeing a lot of maybe finger pointing and questioning about decisions and, maybe blaming. And those are kind of harsh words, but I think that there are a lot of people out there who are doing an incredible job and working incredibly hard to make this happen. And so if we can come with that foot forward, it will help us be more solution oriented so we can get through this, which we will, but we want to get through it quicker than.
Yes, please, as fast as possible. Yes. Commissioner, you were voted in during an unprecedented time that you didn't realize you were going to step both feet into. So you've been quite positive tonight. How do you continue to be that way?
Well, I'm, trying to see everything as an opportunity for growth. And some days are harder than others. I think like everybody else, I also have cried at various points trying to figure out what our next move is. But I'm trying to embrace the opportunities for growth and learning, certainly with my role on the health board, but also with my kids. I've seen my kids step up in extraordinary ways. And so while I worry about them and what this time might be doing to them, at the same time, they're going to tell stories about this to their grandkids someday. Remember the pandemic of 2020. And, I think we have to lean into that. How are we growing? How are we learning? And how are we contributing to our community? And really, that's the most important thing.
Mrs. Underwood, I can only imagine the content that you're going to be asking your children, your high schoolers, to write about in this coming year. Tell me about a little bit of the pot of gold rainbow that you have in store after all this.
Well, I think I told them last year, I said, you are a unique generation. When you say you've overcome this is better than your parents walking uphill both ways to school in the snow. Way better. You got them beat. And I said, look at all that we're learning about doing things in a different way. We are thinking outside the box. Diana took my exact line. How can we grow from this? What are we gaining? And I know as a teacher, I have learned the value of YouTube, and I've learned how to use technology in ways I never, ever expected. I did 2 or 3 YouTube videos a day to learn the technology I needed to deliver my classes last spring. And I feel like I've gained so much. And I'm excited to do things in a different way and think creatively. And I've loved this team of experts talking about creative ways to approach school, because I've gained some ideas while I was here. I was writing things down. So I think we'll stay creative and positive and say, how am I growing through this in a way that would never have been possible before? What is this making possible for me?
Mrs. Nicole Sarti, you signed up to even go online for the summer. So I truly think that in and of itself is a positive moment, because while the rest of us were checking out before the end of June, or at least I was, I'll go that way. At least I was checking out with my children for school. You decided to sign up for summer school just to try this whole thing out. So tell me what you're moving forward with that's so positive for you.
Well, this is definitely an educational learning opportunity, and God has us all in the palm of his hands. So we're good.
Thank you all so much. I cannot tell you how thrilled I am with how this turned out. We've had literally hundreds, if not thousands of comments, and we're reading them and seeing them, and Kevin and I will be digesting them, all of you out on Facebook land who have joined us. This will live right here on Idaho News 6's Facebook page, and also at Idaho Education News, so that you can go back and refer it. You can send it to people. You can quote all of us, and I hope you quote the last part the most, because I think you heard it best from everybody that it's going to take one big, huge village, talking about the state of Idaho, to get through this together. So thank you all for your time and your abilities, and I wish you all the best moving forward with this school year. Thank you.
Thank you.
Thank you.